Hello, my name is Amanda Ringhoff, and I would like to thank the members of the committee for their time today as I discuss results from the National Scorecard Report of 2011 and the impact on infant mortality. The 2011 National Scorecard consists of an expanded set of 42 indicators within 5 dimensions of health system performance: healthy lives, quality, access, efficiency, and equity. It works by the scorecard comparing U.S. average performances with benchmarks drawn from the top 10% of U.S. states, regions, health plans, and hospitals. The top performing countries are included for comparison as well. The health system performance that we will be focusing on today is healthy lives, and the indicator chosen to be the topic is infant mortality. Infant mortality is an important public health measure in the United States and other countries. Infant mortality is the death of an infant before his or her first birthday, and when referring to the infant mortality rate, it is the number of infant deaths for every 1,000 live births. Leading causes of infant mortality include low birth weight, congenital malformations, maternal complications, placenta, cord, and membrane complications, bacterial sepsis, sudden infant death syndrome, and accidents. Although the rate of infant deaths has fallen over the past decade, there are still an alarming amount of disparities amongst different races, income statuses, and geographic locations. Here we see infant mortality by geographic location and race in 2018 as reported by the CDC. While infant mortality modestly improved from 2002 to 2007, from 7.0 to 6.8 deaths per 1,000 live births, collectively, the U.S. rate is still more than 35% higher than the rates achieved by the best individual states. So what has been done to improve the infant mortality? The Safe to Sleep campaign helps parents and caregivers understand what causes sudden infant death syndrome and aids in reducing the risk of SIDS or other accidental sleep-related causes of infant death. Newborn screening can detect certain conditions that are not noticeable at the time of birth, but they can cause serious disability or even death if not treated quickly. Infants with these conditions may seem perfectly healthy and frequently come from families with no previous history of a condition. While performing the screening, healthcare providers will take a few drops of blood from the infant's heel and apply them to a special paper. The blood spots are then analyzed by the lab. If any conditions are detected, treatment can begin immediately. While it has been proven that folic acid before and during pregnancy can prevent birth defects, such as neural tube defect, we have not been successful as a country in providing women adequate prenatal care. Widely used as a measure of population health and the quality of health care, infant mortality is measured as a rate of deaths per 1,000 live births. The infant mortality rate is not only seen as a measure of the risk of infant death, but it is used more broadly as a crude indicator of community health status, socioeconomic status, and availability to and quality of health services and medical technology. By increasing awareness in the public health of infant mortality, we could open up the topic of professional education, meetings at hospitals, libraries, and community centers. The focus could be on healthy lives for moms-to-be, sudden infant death precautions, congenital defects, and how we can play our part in preventing some defects as well as accidental injuries that occur in infants that could be fatal. Additionally, the idea of prenatal care and overall health guidance to expecting mothers should be addressed. The need for this level of care is greater in some areas over others, which is why these policies should begin on the local level and spread to the national. With all of that being said, I am here before you today to request that the Congressional Committee deem nationwide access to prenatal care a priority and put education into action amongst the communities to ensure all are aware of the causes of infant mortality. High-quality care for mother and baby, in addition to community-based intervention, will help to reduce the rate of infant fatalities. Thank you for your time and consideration.